Good afternoon and welcome. Thank you for joining us today in our weekly media briefing and public health update with Montgomery County Executive Mark Elrich. I'm Lorna Virgili, Public Information Officer, Hispanic Public Information Officer, and joining us today is Health Officer Dr. Keisha Davis, as well as Dr. James Bridgers, who is our Director for the Department of Health and Human Services. Also from HHS is Mr. Sean O'Donnell, who is Program Administrator, Public Health Emergency and Preparedness and Response. Today, Dr. Earl Stoddard, Assistant Chief Administrative Officer, is here to talk about a little bit about the extreme heat wave, as well as special guest Wade Holland, who is our Vision Zero Coordinator, and he's here to speak about pedestrian safety. Thank you, everybody, for joining us. Members of the media, please raise your hand during the Q&A portion of this presentation. And with that, good afternoon to you, Mr. County Executive.
Good afternoon, and thank everybody for joining us here today. I want to be blunt about what we're experiencing this summer. We got to be real about this. Record-breaking temperatures, wildfire smoke, and drought conditions are not mere anomalies. And sadly, this is becoming a new global new norm. And unless we take climate change seriously, things will only worsen. And, you know, it's really hard to argue that as a country, as a society, and not just America, pretty much most of the world, is not doing anywhere near the things that we need to do to try to address climate change. So, you know, so far this year, we already recorded over 12,000 record high temperatures. In places like Phoenix, the weather has been relentless with more than 26 consecutive days of temperatures above 110 degrees. People suffered third-degree burns from metal objects or falling on the pavement, and we've lost 7 lives due to the heat. In Miami, Florida, hit a record of 44 days with a heat index above 100, and water temperatures in the ocean around Florida have exceeded 100 degrees. That's hot tub areas. Scorching weather is not limited to the United States. It's obviously global. Places like Palermo, Italy, recorded their hottest day in history at 116.7 degrees. Deadly wildfires are causing mass evacuations in Greece. And Sanbao, China, recorded the highest temperature ever recorded in Chinese history at 126 degrees this month. Even underwater, our coral reefs in the Caribbean and Gulf of Mexico are facing bleaching threats due to rising water temperatures. And in Antarctica, which is a big worry, where it's currently winter, the ice continues to quickly recede during the time of year that it usually doesn't happen. Experts called this a 5 sigma event, meaning this is a once in 7.5 million year event. Unfortunately, we're probably not going to be one and done on this, and this is likely to be a norm. Yesterday's lead story was about the breakdown of the ocean circulation system, the conveyor belt, as they refer to it, in the Atlantic Ocean, which could simultaneously accelerate the melting of the Greenland ice sheet, create cold conditions in Europe, sort of a mini ice age has happened once before, create drought conditions in parts of Africa, and raise sea levels along the east coast of the United States beyond the sea level rise that was already predicted to occur without the breakdown of the circulation system. None of this is normal, but unfortunately it's going to be. And we're going to continue to talk about this and try to offer people pathways that we can all take to lower greenhouse gas emissions, at least in this county. And I will say, you know, I'm really encouraged by some of the steps the governor's taken to green the grid, which is one of the most, I'd say, polluted parts of our environmental systems. This county is one of the most aggressive climate action plans anywhere in the nation, with a goal of 100% carbon emission reductions by 2035. That is going to be difficult, but it's a target we set because it's a target we need to reach. We're not going to reach that goal without deliberate policies, educational campaigns, and serious actions by our residents, businesses, and all levels of government. Government is not going to solve this by ourselves. It's just not possible. I could turn every vehicle electric or running on hydrogen. We could, green every single one of our buildings, and it would not matter if we don't get businesses and homeowners to start taking similar steps in their own environments. And we're past the point of debating whether climate change is going to impact our daily life. Clearly, it already is. And there are a variety of programs that we have in place to assist you and others in trying to deal with this. In addition to electrifying our own vehicle fleet, as promoting more adoption of EVs throughout our county, we're allowing right-of-way charging for those that don't have garages or driveways. We've actually approved the first right-of-way charging stations on the pad between the sidewalk and the street. And so residents are able to start looking for these so they're not limited to having a driveway or a garage. We passed our building energy performance standards as well as our electrification bill to reduce greenhouse gas emissions and energy from our commercial multi-unit buildings. And we're investing in microgrids as well as solar panel technologies. The county is part of the Capital Area Solar Switch Program, which used to be the Solar Co-op, which is be able to provide discount pricing for people who want to switch to solar panels. The region's partnered with Solar United Neighbors to ensure participants can get a quality system at a discounted price. The purpose of the program is to make it easy as possible for residents to install rooftop solar, battery storage, and electric vehicle charging stations for their homes. There are state programs and federal programs that'll give you money to install the charging station at your home. We want all residents to be aware of this and consider signing up before August 30th. We're going to put the website for this program in the chat, and I hope you may share this with your audiences, you folks in the press there. This is important that this information get out. That address is https://solarswitch.com/en/capital area, one word, /home. This year, we have over 415 Montgomery County residents who signed up to learn more about going solar. That's a good start, but in the county of over 1 million people, we need a lot more folks involved. I personally installed solar panels on my own house. I'm actually saving money, enough money to offset the cost of the panels. And we're at a breaking point. Actually, we're pretty much beyond the breaking point. And everything we can do for the environment matters. We're bracing for our own extreme weather conditions tomorrow and through the weekend. The National Weather Service predicts a heat index of up to 105 degrees on Friday and Saturday. This would trigger a heat emergency alert across the county, a measure meant to protect everyone from the dangerous and potentially deadly heat. Remember, the heat can pose a health threat even at night when temperatures are lower. Our departments are ready to respond with temporary policies and procedures to safeguard people and animals. County facilities like libraries, swimming pools, recreation centers, and senior centers will be available for cooling off during normal operating hours. Ride-on buses will serve as water sources and shelters from the heat. Our homeless facilities in Silver Spring and Rockville will remain open around the clock and providing a safe haven even during the day when they're normally not open. To ensure the safety of our animal companions, animal services leaders have issued special instructions to their staff and volunteers at the adoption center. We need to make sure that pet owners do not leave pets unattended in vehicles or outdoors during a heat emergency. And there are criminal penalties if you do this. But beyond that, all the measures that we are putting in place, the crucial aspect of this is looking after one another, especially the elderly and those without air conditioning. We have to come together as a community to support and protect each other during these extreme weather events. Please think about people you may know who are isolated or living without air conditioning. Their units can get extraordinarily hot and unsafely hot. So if you know somebody and you can help them, please offer to help them. Now, to provide more insight into the county preparations and the overall importance of taking hot weather seriously, I'm going to hand it over to Earl Stoddard, who oversees both emergency management and public safety. So Earl, it's yours.
Thank you, Mr. County Executive. A few more things I want to highlight. Obviously, back in 2020, the County Council amended the county code to require air conditioning in rental units. That was an important piece of legislation to address climate change, as the County Executive alluded to. Renters who have any issues with that, so that requirement's from June 1st through September 30th, has to keep the units below 80 degrees. That's the requirement by law. And if they have issues that they think may be a violation there, they should report those violations to our 311. Our housing code enforcement will follow up on that. County executive alluded to the work we're doing with the homeless to keep the shelters open and operating during the day to allow our homeless population a safe place to refuge. Our homeless outreach teams and the police department will be working collaboratively to get the homeless off the street and into shelters. And if they refuse, they're going to be providing them with additional water and make sure they have plenty of water and resources if they choose not to go to the shelter. If a member of the public observes someone who is homeless and they believe that they may be in distress or they want them to receive some assistance, they can call our homeless outreach number at 240-907-2688. County executive talked a little bit about animal services. They will be enforcing executive regulation 17-17, which requires that animals not be tethered outside for long periods of time in this weather without shade or other refuge for them. And so they will be doing that enforcement. They will also be working with the commercial kennels to make sure that they're observing the same rules to make sure that we do not have animal loss of life in the same time that we're focused on human loss of life. And then finally, the county executive alluded to the libraries and rec centers. They will be open and operating on Thursday, Friday, and Saturday. Libraries are open till 8 o'clock tomorrow, and then 6 o'clock on Friday and Saturday. Excuse me. I think a key thing here is the periods of extreme temperature that we're really concerned about are mostly going to be middle of the day. And so obviously the hottest times of the day in the county are generally between 2 and 4 p.m. And so we want to make sure there's a buffer on either side of those time ranges to make sure that we've got places for people to go. As a reminder, we also have regional service centers. There are a number of indoor malls in Montgomery County. There are a number of places that are open to the public through which you can seek refuge. Many other counties have to open specialized cooling centers. We are blessed in Montgomery County to have an enormous amount of resources for the public, libraries, rec centers, a much more robust system that is available, throughout the year that allows us to send people to those locations instead of having to stand up separate locations for the purposes of being just cooling centers. The last piece I want to mention is if you have to be outside, and if you have to be outside doing any kind of work, you have to be extremely cautious. Take frequent breaks in the shade, consume lots of water, be on the extreme outlook for the symptoms of heat exhaustion and heat stroke. So the heat exhaustion symptoms are dizziness, thirst, heavy sweating, nausea, and weakness. If you experience any of those symptoms, move to a cool area, loosen your clothing, sip cool water. And if you don't see an abatement of those symptoms quickly, you need to seek medical assistance. If you start to experience additional symptoms like confusion, dizziness, or you start to feel like you're going to faint or lose consciousness, that may be a sign of heat stroke. Call 911 immediately. And with that, I'll turn it back over. I'm not sure where we're going next, but that's all.
Any questions? If people have questions about this.
Yes, Dr. Starr, we're going to take some questions now from members of the media regarding the extreme heat. Members of the media, if you have any questions, please raise your hand. And I see Kate Ryan, WTOP is there. Hi, Kate. Missed you. Good afternoon.
Thank you so much. I did have a question about access to things like pools. How are we doing? Department of Recreation, pool access? Is there any issue there? We've seen some of the headlines out of the past week in Baltimore where they had to close pools for maintenance and staffing issues. And we saw little kids breaking in because, it's hot out. Are we in anything like that? What kind of situation do we have there? And tell me more about commercial kennels. Are you talking boarding facilities or something else? What are we talking about?
So I'll take the first question, I guess, first. So that we have no pool closures at this point because of any maintenance issues or summer closures or cleaning, any of that like at this point. We're facing some of the same lifeguard staffing challenges that everyone else is, but obviously we've prioritized the next several days to try and make sure that we've got appropriate staffing at the facilities, recognizing that pools will be an important part of a life safety issue, not just an enjoyment thing for people. That's, getting cool is an important thing for adults and children. And so we're not expecting closures related to staffing. Now, obviously, we've also had some closures related to extreme use. We fill up the pools. Now, I can't promise that won't happen because obviously, if once the pools are full of people, it's not safe to continue to put people into the space. But that seems to me, from our recreation partners, the only risk of if the pools just fill up. On the commercial kennels piece, obviously, yes, there are professional boarding locations that have sort of outdoor runs typically, and those need to make sure that they have a covered space and that the animals have a safe place that they can enter into the building, that they're not just left out in the sun, tethered or untethered, for extraordinary amounts of time. I think the county regulation limits exposure up to 2 hours, but also it adds additional requirements during these heat emergencies, of which we will be in one. The emergency management declared the heat emergency effective 11 a.m. tomorrow morning, and it will run through 9 p.m. on Saturday. And so we reach out to all those commercial kennels, our agricultural partners who may have animals that are outdoors. Obviously, because of licensure requirements, we have good connections with all of them. And so that's what our animal services is doing today, is doing that outreach to make sure that people are aware, they understand the regulation, and that, they recognize that we will be enforcing it.
Thank you very much. If I can follow up on the heat exhaustion, heat stroke, and that's very helpful information, because I think a lot of us are like, oh, I just don't feel great. This might be for Dr. Davis or Dr. Bridgers. I wonder if people seem to be reluctant to dial a 911 in those cases. What would you do to encourage them to know, really, you have to take this very seriously?
Yeah, I mean, heat exhaustion, if folks are feeling overwhelmed by the heat, we want them to do those cooling measures, drink some water, move inside, try and cool down. And if that's not working, heat stroke is a medical emergency. And so we really do want people to be calling 911. It's a medical emergency. People can become unconscious. They can have seizures. It really is something that folks want to take seriously, and not just try and treat by yourself. And so prevention is always important. So stay inside, stay cool when you can, keep drinking, limit activity. And in the event that things get overwhelming, then you need to call on the professionals for help. Gotcha.
And lastly, I promise on this one, children or pets or even older relatives in cars may be waiting on people on errands. If you see that, is there a law that protects people if they decide they've got to bust into that car to get that person or that pet out of there because there's an extreme heat situation? I don't know what the laws are on that.
I don't either, but that's a case where they certainly should be calling the police, not emergency line, immediately. Or if they, if someone looks to be in distress inside a vehicle or an animal, call 911 in those cases, and we'll dispatch a unit to respond, and then let the officer be the one, having to break the window if they have to. But certainly that's what public safety is all about. So they certainly can reach out that way. If they see someone in medical distress, frankly, we all do what we have to do in certain circumstances, and to save lives. But obviously, if they believe it may be a risk, but it isn't an imminent threat to life and safety, then they should just call the police non-emergency line, or in case of there's any concern about, call 911.
Got it. Thank you very much.
Thank you, Kate. Thank you, Dr. Stoddard and Mr. County Executive. Members of the media, any other questions regarding the extreme heat? Raise your hand. No more questions on this topic? Okay, Mr. County Executive, we can move forward with the other topics. Thank you.
Okay, so again, share with your audiences information about the county's response and to extreme heat, and please dial 311 or visit the heat emergency website at montgomerycountymd.gov/heat, and we'll put everything that we talked about today, make sure that's in the website. I think you all know about our cartoon character Abuelina. During our ongoing efforts to prevent COVID and administer the vaccinations, we've discussed Abuelina and her family in previous briefings. And these cartoon characters representing the Latino community have been central to our Spanish language outreach, and they were very effective. Abuelina's impact has been so significant that it garnered an Emmy recognition on both national and international levels. And just this summer, the team behind Abuelina received their well-deserved third consecutive Emmy. Given the remarkable success of this campaign, I saw the need to copyright her image. So we did, ensuring that we can utilize her in other public safety and educational initiatives. One logical application was incorporating Abuelina into Vision Zero pedestrian safety efforts. In coming weeks, Abilene will play a crucial role in educating the community on pedestrian safety. For example, how do you navigate pedestrian hybrid beacons that are newly installed in areas like Silver Spring, Wheaton, and Gaithersburg? This cutting-edge technology empowers users to stop traffic so they can cross streets safely. For more insights into this campaign, safety upgrades, and overall road safety, I'm going to pass the floor to Vision Zero Coordinator Wade Holland. So please give us some more information about this.
All right. Thank you, Mr. County Executive. Again, my name is Wade Holland. I'm the Vision Zero Coordinator for the county government. To talk to you all a little bit about our new campaign, about informing folks about pedestrian hybrid beacons and how we're incorporating La Abilena into these campaigns. So pardon me 1 second while I switch over to a short slide deck to give you some pictures and images of the new campaign. So as the county executive mentioned, we have some great partnership as part of developing this campaign with the Latino Health Initiative within the Department of Health and Human Services. So I want to, at the top of this call, thank them for trusting us to use La Abilena correctly and make sure that we're making a combined thing, because the idea is this isn't a separate campaign from what the Abilena and her family are doing for COVID, but also eventually getting to more and more areas of safety to reach out to our Hispanic Latino community in Montgomery County. So what we're doing as our first kind of pilot campaign with La Abilena, and we're first just using Abilena the character, we're not using the family, but hopefully in future campaigns we can incorporate more family members into the campaign, is to talk about the pedestrian hybrid beacons. The Montgomery County Department of Transportation has really been installing these quite a few each year since late 2017, when our Vision Zero Action Plan went live. That was also the time where the Maryland Department of Transportation actually allowed us to start installing these, because prior to that, they were not allowed to be installed on any road in Maryland. But as we get these installed, we have some feedback and campaigns we've done before about these. There's still some confusion about how to safely use this, whether you're walking, driving, or on a bike. So part of what Abilena is helping us out with is this bilingual campaign, but obviously it's a Spanish first campaign to work with folks and say, hey, if you're walking, this is how the signal works. And you can see this going through the slides right now in this GIF about how it works. And we're trying to tell people it's easy as 1, 2, 3 for pedestrians. They push the button, wait 16 seconds, and then they'll get the walk signal on demand. For them, it looks just like a traffic signal on their end. The confusion we tend to get from people in our outreach is about for drivers, because there is no green signal with a pedestrian hybrid beacon. So in this, we're also saying, hey, it's easy as 1, 2, 3. When it's dark, you can go straight through, just like with a traffic signal. When it's yellow, prepare to stop. When it's red, you need to legally stop and wait for the pedestrians to clear before you can go through. So to get this information out there, there's one thing, social media is great. You can get a lot of views that way, but we actually really wanted with this campaign to meet people where they are, get the message out in multiple different ways. So one of the things we're doing throughout July and August is we call our pop-up events. You can see some images on this slide where we're going right where the beacons are installed, talking to people who are walking and driving, throughout. This is in downtown Silver Spring. The larger picture on the left is downtown Silver Spring, Fenton Street at Rotor Road. You can see people crossing with the light there on red, and luckily all the drivers are stopped. On the upper right is a picture from the Giant on Muddy Branch Road, where we were this past weekend talking to folks about the pedestrian hybrid beacon that's just down the road on Muddy Branch Road. We're also outreaching to people who are in our county buildings. So you can see in the lower left there an image of the campaign and learning more information in the county executive building. This is also being used in libraries that have screens throughout the county. So not just trying to reach people on social media, but really getting out on the street. We're also collecting comments as people come to us in this campaign to make sure that as part of bringing Abilena into pedestrian safety, we're talking to people in English and in Spanish about their thoughts on the materials, what do they think about the pedestrian hybrid beacons, answering those questions while we're there, and then helping us build potentially for future versions of this campaign, really making sure, just like the original campaign that was built by Latino Health Initiative, it's really built by and for our community. So with that, if there's any questions, I can take those now.
Thank you, Mr. Holland. Members of the media, I see Kate Ryan has her hand up. Questions right now regarding pedestrian safety and La Abuelina campaign. Kate, good afternoon to you again.
Thanks again. I do have a question about those, the PHB. I tended to refer to them as hawk signals. Maybe I have that scrambled. And we had a glitch here, so I'm not sure if that was unique to TOP or other people experienced it. Can you take us through, because you're right, drivers in particular, I think pedestrians they're pretty well tagged into having to hit a button, but drivers look at those and go, what am I supposed to do? Can you walk me through? I'm a driver, I'm approaching an intersection, the pedestrian has hit that button. What am I going to see and what should I do?
All right, thanks for that question, Kate. Yeah, and that's what we're trying to clear up for everyone, is how to use these things. So they are fairly new to Maryland, not so new, but they've been in the district for quite a few years before they were starting to be installed in Maryland. And that's the confusion, right? Because they don't get a green signal. So there's kind of confusion about, well, what do I do when it's dark? So the pedestrian hybrid beacon, as you mentioned, is also sometimes called a hawk signal or a hawk beacon. They can be used interchangeably. I think the new parlance now is PHB, or pedestrian hybrid beacon. I'd like to change the names on us to keep everyone confused, I guess. So if these are dark, so again, they have the 2 red lights on the top and then the 1 yellow light on the bottom. When those are dark or they're kind of inactive, you can kind of go straight through. Obviously, you want to check the crosswalks, make sure no one's crossing, even with the lights are off. But you're allowed to proceed with caution through there. If it's yellow, same as a yellow light on traffic signal, get ready to stop. If it's red, they need to stay stopped for the entire sequence. We do have an issue sometimes with drivers. It's still a red light. They don't see anyone coming and they proceed through. But again, just like a traffic signal, as long as that's a solid red, you're not allowed as a driver to go through until that is completely gone inactive or dark again.
And that's a question for me, because in DC, I see what they do is they'll go solid red, then they'll flash, and then they'll go off. Do these go solid red and then go off?
Yeah, so this one, we basically want to take any discretion out from the drivers when we install these in Montgomery County. So you're right. If you're in DC, there's a second phase where it goes solid red and then to a flashing red phase where you can kind of treat it like a stop sign at that point. For our installations, they currently stay solid red, then they turn off. So we want to really err on the side of safety and have the drivers stop for that whole time the pedestrians may be crossing.
Got it. And then can I get a sense of what kind of feedback you're getting in the Latino community? I know Abuelina was really favored during COVID because she seems like your favorite friend's, your mom, or your own grandmother, that person in your life who you would lean on, and you would also listen to them if they wagged their finger at you, you know? What's the kind of feedback you're getting regarding Abuelina stepping into the traffic world, if you will?
I think overall it's been positive. A lot of the comments we've been getting in English and Spanish have been the same. We're actually, as part of this campaign evaluation, collecting those, like I said, those comment cards. We're collecting them at each event, and then we're going to analyze those when we get done and compare what we heard in English as well as in Spanish. People overall like the character. They find, she's pretty friendly. That's what I like about her. She's not there wagging her finger saying, no, you're doing this wrong. She's really trying to say, hey, we're out here together. We want to make each other safe. And with her lessons from Abuelina, here is how ways we can keep each other safe on the roadways. So people tend to like the character. Just kind of when we're out there on the table, just really clarifying for folks what the PHB is, why it's there in the first place, why is it different from a traffic signal, and clarifying any questions about how to use it.
Gotcha. Last question on that, tied to her. How much homework did you all have to do on language? Because I know that my friends from El Salvador speak a different kind of conversational speech than my friends from Ecuador, than Venezuela. How did you balance that?
Yeah, so I know with Abuelina, I think, is El Salvadorian is her language. So this is actually, there's no audio for this part of the campaign. So it's just text at this point. But now we went through a couple different drafts of like, how do we actually translate the word PHB? We actually didn't do a direct translation from the English. We called it a crossing device just to make it a little simpler as something that would translate better. So we spent a lot of time with different folks testing out the language to make sure it was something that people actually understood when what we were writing out there.
Gotcha. Thank you very much. I appreciate it.
Oh, thank you.
Thank you, Kate. Members of the media, any additional questions regarding this pedestrian safety campaign? Raise your hand, please. No more questions? Going once, twice. Thank you, Mr. Holland. You can remain here in the call, or you can drop off if you need to go. Thank you for joining us.
Well, thank you so much. I put the website of the campaign in there if anyone has any other questions. There's some great resources on the website.
Thank you. Mr. County Executive, back to you.
Yeah, thank you so much for that presentation. And, for those of you who don't remember the origins of Abuelina, they came out of listening sessions that our folks were doing. And one of the things they found and this is with real people, they found that there would be disagreements within a group, older, younger people, whatever. And but when the grandmothers spoke up, the group tended to coalesce around the views of the grandmother because they guess they were taken as, neutral, serious, protective influences. And so what they had to say was considered of higher value to the group as a whole. And out of that was born the concept of Abuelina to do the campaign we ran around COVID. So we're hoping that Abuelina's advice on pedestrian safety is equally effective. So I'm encouraged by what happened the first time, and I'm looking forward to implementing this. This Monday was pretty momentous. We came together to celebrate the passage of the rent stabilization bill, which I had the privilege of signing into law. This legislation is going to play a crucial role in limiting yearly rent increases to inflation plus 3%. It doesn't mean it has to be 6%. Landlord doesn't have to take the 3% plus. And our history over the last 30 years is that rents, for the most part, have averaged right around inflation. Of course, you've got to remember, unless everybody had, for example, a 3% rent, an average of 3 includes people who we know gave less than 2%, as well as people who gave more than 3% rents. Just to be clear, the average is not necessarily everybody's behavior. But passing this legislation was really important in order to provide predictability and stability into many of the lower income households in Montgomery County. And frankly, a lot of households that just don't have the wherewithal to afford rents in Montgomery County. And I'll give you one of my favorite examples. I Googled before the press conference the average rent in Bethesda, and the average rent in Bethesda for a one-bedroom apartment was around $2,500. That's the average rent. That includes the older buildings in Bethesda where the rents are under $2,500. So you can well imagine that the rents in the new buildings are over $2,500. But my point is, a $2,500 rent increase means spending $2,500 rent means spending $30,000 a year. And if the maximum recommendation for how much of your income you should be able to afford, you should be able to spend on rent is no more than 30%, then you would need a $100,000 income to afford a $2,500 a month rent increase, which means we're not only talking about folks who qualify for MPDUs, which serve people mostly between 60 and 70%. We're talking about all these young workers, the people we're counting on wanting to stay here. And this is probably one of the reasons they're not, is they can't get units. They make too much money for an MPDU, but they don't make enough money to afford the market rate units that are being built. If you made $80,000 a year, which would be a pretty good starting salary for a lot of people coming out of college, you wouldn't get an MPDU. And you also wouldn't be able to afford market. And so there's a real value in stabilizing rents for more people and as many people as possible. Stability is something that many of us who are homeowners experience, and we kind of take for granted because the cost of our housing is predictable. It's something that doesn't exist for many renters. I think a lot of people think this is normal for society. We forget that stability in housing costs is not normal in the world of renters. And the stress over constantly having to wonder whether or not you'll be able to afford to stay in your home in the future wears on families, and it's particularly hard on children. And this is something that people worry about. Again, in my world, I don't worry about whether I'm going to be able to afford my house next year. But for tens of thousands of households in Montgomery County, the next rent increase can be the difference between being able to stay there or losing your housing. I'm really appreciative that the council passed this bill. I want to thank them and the many people and organizations in the community who worked so hard to convey the need and for the importance of rent stabilization. I saw this in Tacoma Park, how meaningful rent stabilization can make a difference in people's lives. It was good for families, and frankly, it was good for our schools. When children don't have to move because of unaffordable rents, when parents don't have to stress on sky-high rent increases, this is really beneficial. Mobility in schools keeps kids from getting attached to friends and getting attached to a school. And there are a lot of parents who are thrilled about knowing that when their kids started kindergarten, their kid would be able to finish school in the school they started in and be able to go to other schools in Tacoma Park. This is something that, has, been pretty unique in Tacoma Park. And it's something that ought to be more normal for more people. I do want to note a number of developers worked very hard to defeat the bill, and they seem to ignore the provisions of the bill that protect them. And they misrepresented this as keeping them from being profitable. And that's a completely false narrative. They're allowed to increase rent every year by inflation plus 3%. We've got 30 years of history that indicate that's not what happens. That's not what they needed to stay in business. And this is inflation plus 3% with a cap of 6%. If it goes over 6%, they bank the amount that goes over, and they can apply it to the next year when inflation plus 3% is under 6%. Most working families don't see 6% increases in their income every year. So the 6% increases, if that were to become a norm, would become a real problem for many families. The bill also allows landlords to go above that amount if they show they have actual costs that are higher than the 6% increase. So if you actually experience in your building inflation costs that exceed what we allow in this bill, you can get a larger rent increase. You just have to show, just like you do on your tax returns, how much money you're making. And are your costs greater than, did they go up year over year greater than inflation? The bill also allows increases for capital expenditures, which are big capital projects that fall outside of regular maintenance, like roofs and boilers and AC systems. We wouldn't expect people to absorb those kind of costs, which occur in large lumps in 1 year with the smaller rent increases. So landlords are able to maintain their prior net operating income percentage. So if your percentage of net operating income was 60% before you did a capital improvement, new rents will be set at a level that allow you to maintain your historic profitability. So this is pretty common sense stuff. No one is being asked to invest without getting a fair return on their investment. They'll be able to get a return on their investment, and then they'll also be able to maintain their properties. What it does protect against is rent gouging. And frankly, what it protects against is, and this happens in the county, has happened before, and we're anticipating it happening again, when the county invests, say like in the Purple Line, and properties that house lower income families suddenly become next to the Purple Line, become more desirable, landlords are able to raise their rents, not because they put a dime more into the building than they put before, but because they're in a more favorable location now, and so they can get more rent for being in that location. This is going to have a devastating effect on displacing people who live next to the places that we're improving, because we say we want to improve things for everybody. Well, it's not going to be for everybody if tenants are allowed to be pushed out of these communities after the county invests and fixes them up. That would not be a right thing to have happen. This is a very reasonable bill. It was a compromise, and those who say differently are simply trying to use scare tactics that are not helpful to preserving and extending affordable housing. I also want to make a comment about markets, because I hear people say markets should solve this problem. We wouldn't be in this mess if markets solved the problem. If markets solved the problem, they would look at the demand for housing that people can afford and somebody would produce it. That doesn't happen in Montgomery County. Frankly, it doesn't happen in most of the country. So, you know, it is what it is. This is important for us to do this. We're trying to preserve as much affordable housing as we can. If markets had solved the problem, we wouldn't be here. So we're doing what we need to do in order to make sure we do not lose the ability to people to stay in this community. This bill is a victory for tenants. It's a victory for people and families, communities, and businesses of Montgomery County. I want to emphasize businesses. I was at a meeting of one of the business groups in Montgomery County where the owners, many of whom have employees who earn lower wages, were grateful for this because it meant that their workers will be able to stay living in the community. If we were to drive out their workers so they couldn't live here, many of them would wind up not working here. And we would create a labor shortage, which would further exacerbate efforts to have the economy recover. So, you know, driving people out of this county is going to damage the ability of businesses to attract and maintain their workforce. And we know this is true at the lower end, but as I said before, it's also true for that group, which is, you know, probably coming out of college, young, starting their careers, not earning what they earned, or not earning enough to get market rate and making too much to get an MPDU. As important as this bill was alone, it's not enough to address our housing issues. And we're going to continue to work on other initiatives and investments and policies to produce, preserve, and protect affordable housing here. On to the farm tour. So this last weekend, the county had a farm tour, and I was able to get out to 4 farms in Montgomery County. We have 558 farms. They employ over 10,000 people. They contribute $281 million to our economy. And we owe a lot to this vibrant agricultural community. It is significant and an important part of our county, and we can't overlook that. Last weekend, I had the pleasure of attending our annual farm tour, and I'd like to extend my gratitude to the farms and wineries and breweries in Montgomery County that took part in this year's farm tour and harvest sale. I was able to visit 1 winery, 1 cidery, and 2 farms. And now with our grape crush facility at Crossvines, I'm looking forward to even more fabulous wines in the county. All of this should add to our growing agro-tourism, which in turn will have a more positive effect on the Montgomery County economy. Looking ahead, we have another significant event on the horizon. The Montgomery County Agricultural Fair runs from August 10th to the 18th. And the event not only raises funds, but also brings much needed attention and awareness to the needs and concerns of our farmers. I want to take this moment to urge the media that covers Montgomery County to keep the agricultural community in mind. Their dedication and resilience and contribution to our county are vital aspects that deserve recognition and promotion. And their work greatly enriches our community. And having farmland in this county to the extent that we have it also contributes to a healthier environment, both healthier air and better water. I want to share with you a powerful and thought-provoking question that emerged during our recent Public Safety and Youth Engagement Forum in Wheaton. A concerned woman simply asked this question. She said, how do I identify what fentanyl looks like? And how do I know if my child is using drugs? And I kind of realized that for all we talk about this, we don't always show pictures or illustrations of things that people should be looking for. This question hits home and reminds us the fundamental concern we're going to have to address in our discussions about fentanyl prevention. To begin, we've observed a significant amount of fentanyl being confiscated in tin foil, but some individuals use it to smoke the drug. In fact, this has led certain communities across the nation to take measures like retailers locking up foil due to increased theft for fentanyl usage. So if you see little folded packages of aluminum, this is a sign that you may be dealing with fentanyl use or some other drug use. When I say little packages, I mean something, I don't know, the size maybe an inch wide and a couple of inches long, that's folded over. It's not, little is not like tiny, and it's also not like a small book, but it's pretty small, easy to conceal, and it's of concern. Beyond recognizing the physical appearance of fentanyl, parents need to be aware of the signs and changes they may notice in their children if they're using this dangerous drug. So let me share some of the key physical, psychological, and behavioral signs. Physical signs and symptoms include changes in appetite, bloodshot or unusually sized pupils, a runny nose that can't be attributed to allergies or a cold, impaired condition or slurred speech, unusual sleep patterns, drastic changes in social circles, loss of interest in activities they once enjoyed, extreme fatigue and sadness, and neglecting personal hygiene. Psychological signs to watch for are increased anxiety levels, sense of euphoria or heightened energy erratically, and irritability that seems out of the ordinary. And behavioral signs include mood swings, displaying paranoia or suspicious behavior, missing important appointments, neglecting responsibilities, being secretive, giving up hobbies and social interactions, and facing financial difficulties or unexplained spending. During times of need, it's essential for everyone to remember and promote our county's crisis center phone number at 240-777-4000. This number serves as a lifeline for those who are in need of help or are concerned about someone else who may need assistance. To ensure parents are well informed, I've tasked our HHS teams with improving our communications about these signs and other critical information related to fentanyl awareness. No parent, no resident should ever be left in the dark when it comes to recognizing fentanyl use. Together, we can combat this threat, protect our loved ones, and work toward a safer and healthier Montgomery County. So I want to thank you all for tuning in today with our part. I'm going to turn this over to the community health team that is deeply concerned with the fentanyl issue. And I'll start by turning this over to HHS Manager Sean O'Donnell.
Thank you, Mr. County Executive. Very quick update today on COVID. We've been tracking on the transmission rates and our hospitalization rates. And what we've seen over the last week is a very, very mild increase, up to 11 cases per 100,000. Again, this is only a few additional cases compared to the previous weeks. The hospital rates have gone up just slightly as well. When you look at test positivity for PCR tests, I know not a lot of PCR tests being done at this time, but across the state, we've seen that test positivity go up just slightly. Again, looking at the moving average of case rates, these are the daily rates. We see both at the state and the county level, those have gone up just a little bit. Some of this could be the continual evolution of that XBB strain. There are sub-strains that continue to be added to the CDC tracking list. These all have the same spike protein as the XBB, so it's likely why it's not spreading more rapidly around our community, because the existing immunity from previous infections and from vaccinations seems to be helping. So we are seeing a little more activity, but not a tremendous amount. And just to remind folks that we have historically seen a summer wave. Sometimes it's been a little bit earlier, sometimes a little bit later. So, you know, this could be just a very mild version of that. You know, it's hard to say. Again, our hospitalizations, our numbers you can see have been trending generally down. They've gone up just a little bit over the last week or so. And those are the the updates we have. We are getting ready for our back to school vaccinations. That's all the specific grades that have school required vaccines. Additionally, at the HHS sites, we will be providing COVID booster shots for school age kids who are coming back for their back to school vaccines as well. So we'll also share more information as it comes out about the updated booster that's expected in mid to late September. Again, I know we mentioned this in previous weeks, the RSV, there's a brand new RSV vaccine. The FDA has recommended that for individuals 60 and older. They've also recommended it now for some pediatric individuals, and we're waiting for the CDC's ACIP team to give additional guidance on the pediatric version, and that will likely be available in the fall as well through private healthcare providers. At this time, I'd like to turn it over for any questions.
Thank you, Mr. O'Donnell, Dr. Bridgers, Dr. Davis. Do you have any comments, any remarks, questions? Okay. All right, members of the media, raise your hand if you have questions regarding the public health update and other topics. Any questions? No questions? Going once, twice? I guess we're done for today. Thank you, everybody, for joining us. Have a great afternoon. Stay safe. We'll see you next time.